So let's just go straight away to the answers, the questions. Also, we are dealing with case study 2020 MCQ, the MCQ part as section A. Antacid therapy release symptoms. Antacid, when we are talking about antacid, that's gastritis already. And when we are dealing with things like gastritis, you need to also know the various medications or the various class of drugs that we use in the management of gastritis. You have things like antacid. An example of antacid, you can see things like G tablet, you can see things like magnesium sulfate, you can see like aluminum trioxide, you can see things like Malox, you can see things like as many of them as possible. All of that is to neutralize the acid content. Then we have H2 receptor blockers. We have things like you have there are many of them, and things like antibiotics for the management of gastritis. And we understand the physiology of peptic ulcer or of gastritis. You understand why this class of drugs are. But now they have pinpointed one of the classes, and they want let's read the answers rapidly. They said A, rapidly; B, neutralization of gastric acid; C, protecting the mucosa from acid. What is the right answer to that question? Now you notice that protecting the mucosa from acid, this is not the function of antacid. Antacid, what they do is that it's a class of drug that helps in the neutralization of the acid in the stomach so that the person who is suffering from gastritis may not have heartburn. So you listen, the right answer to that question is going to be B, not all of the above. The action is rapidly, yes, but the answer is B. So most often at time, if you are in that hole, the right answer should be B, not any other thing. A chronic cause of gastritis, question 2, a chronic cause of gastritis is infection with a microorganism called, we have E. coli, Helicobacter pylori, Salmonella typhi, Staphylococcus. The right answer is going to be B, right? Helicobacter pylori. E. coli is a normal flora found in the small intestine. Staphylococcus, those are bacteria. Salmonella is responsible for typhoid, right? Salmonella typhi. So Helicobacter pylori is a normal flora found at the pylorus of the stomach, right? So it's a normal flora that dwells there. So immediately as when the mucosal linings of the stomach are eroded, these bacteria find its way in blood. Hence, when they do a test for gastritis, it's the bacteria they see. When they see it, they diagnose that you have gastritis. Which of the following is a complication of PUD, peptic ulcer disease? Now we have complications of peptic ulcer. We have duodenal ulcer and we have peptic ulcer. Take note of these two, peptic ulcer and duodenal ulcer. They're asking what are the complications of peptic ulcer disease. We have GITB, perforation, obstruction, all of the above. Yes. The right answer to that question is D, all of the above. Peptic ulcer can result to intestinal obstruction. How? It can result to because of indigestion. Most often at time, people with peptic ulcer disease, the process of digestion at the level of the stomach is reduced, right? It's reduced. It can result to perforation, especially when the person is uninformed or is uneducated about the condition that he or she is going through. So the person continues taking things that he or she is not supposed to take, and because of that, the stomach walls erode and it can perforate, right? And you know that when we have there are 4 layers of the stomach and also 4 layers of the intestine. We have the serosa, the mucosa, submucosa, the serosa, and all of that. So if all these layers are perforated, it can lead to, so the right answer to that question 3 is D. Complications of peptic ulcer includes bleeding, perforation, penetration. Bleeding directly manifests as, yeah, this question is so tricky. You see, you notice that question 3, and I forgot to also mention that most often at times some questions have answers in it. That's why you also need to bear in mind that some questions always have answers in them. So they have already given you already that some of the complications include bleeding, right? Includes perforation, right? And they said include penetration. So bleeding principally is melena. Melena is a dark black stool, dark black stool, dark black stool, right? Blood in stool. So that's the right answer. A. That's question 4, right? Mechanical causes of intestinal obstruction includes the following except one. So they're asking us to give the mechanical causes of intestinal obstruction. The mechanical causes of intestinal obstruction, they're asking us to give an exception. So we take note of such a question. Mechanical causes of intestinal obstruction. It involves mechanical causes of intestinal obstruction. You notice that volvulus can result to intestinal obstruction, invagination, intussusception, all of them they can result to intestinal obstruction. Gastritis can also result to intestinal obstruction because gastritis is inflammation of the intestinal lining, and if the inflammation worsens or if it further increases, it will block the way to the intestine, and if it blocks, it will lead to an intestinal obstruction. So the right answer to that question, as an exception, is adhesion. Which of the following classes of drugs block catecholamine and sympathetic nerve stimulation during myocardial ischemia? Which of the following medications? Now let's look at it. Let's look at the answers that they are giving us. Beta adrenergic blockers, angiotensin inhibitor blockers, and angiotensin enzyme inhibitors. That's wrong. Calcium channel blockers, no. Nitrates. Now, if you guys have done management of hypertension, the various classes of drugs in it, you will notice that most often at time during hypertension, when a person is hypertensive, the heart rate of that individual most often at time increases rapidly, and because of the increase in the heart rate of the patient, it easily results to heart failure, in that the muscles of the heart at times, because of hypertension, and also because most often at time hypertension can also result from fats, from excess weight and all of that. And so when fat accumulates in the coronary arteries, it leads to a clot. And when that clot occurs, that particular region, blood is reduced in a particular part of the heart. And you and I know that the heart is made up of three layers of tissues, three layers of muscles, or three layers. We have the endocardium, myocardium, and pericardium. And now the myocardium is responsible for heart contraction. And when this occurs, when that clot is formed because of hypertension, the only drug of choice, the only class of drug that can be used to dissolve that clot, right, to dissolve the clot, for us to like reduce, like prevent heart failure, is beta adrenergic blockers. So that's the right answer, beta adrenergic blocker, which is the most common cause of blockage of coronary arteries disease. Coronary artery disease, take note, we say coronary arteries are those blood vessels, or veins are those blood vessels that are responsible for supplying the heart with blood. Even as the heart supply blood to the whole body, the muscles of the heart, the blood vessels that supply the heart with blood, they are called coronary arteries. And so they're asking which of the following, which is the most common cause of blockage of coronary artery disease, right? Which is the most common? We have atheroma, or you can still call it atherosclerosis, right? That's hardening or accumulation of fat or plaque or cholesterol at the walls of arteries. Thrombus, embolus, none of the above. You notice that the right answer to that question is going to be atheroma. Why? Because it leads to the formation of plaque. Thrombus is made up of air. Thrombus can be made up of also clot, right? You see that there are two answers, there are two questions here. We have atheroma and thrombus. Why did I choose atheroma? Because I chose atheroma as the right answer first, because atheroma comprises so many things that has resulted to a clot, right? You can note you Yes, so many things like plaque formation, cholesterol, fats, ions, it accumulates to form a clot, and that clot we call it atheroma. Now, thrombus also is a clot, but it's not specified. It's not specified. So the main answer to that question is atheroma. So that's a trick they can give you right? They can give you at times a question like this. They can give you. They can just write for the examiner. They can say A and B are correct. So in any of them you can mark, you get the answer. But now, don't try that. But always choose the best among all. Patients with respiratory disease can present with apnea. Apnea. What does that mean? Apnea. What's the meaning of apnea? Apnea occurs when you experience difficulties in breathing when you are lying down. Patients with respiratory disease can present with apnea. So we are saying difficulties in breathing when lying down, temporal sensation of breath, increased respiratory rate. You see that the right answer to that question is going to be B. Why? Because it results to when most patients with respiratory diseases, they always experience difficulties in breathing when they are lying on the bed, especially with their back. In this respiratory disease, allergens trigger the release of histamines and other inflammatory chemicals that cause intense bronchoconstriction. Intense bronchoconstriction. In question 9, in this respiratory disease, allergens trigger the release of histamines and other inflammatory chemicals that cause intense bronchoconstriction. Right? Bronchitis is inflammation of the bronchus. Asthma. It could also, the trachea is involved and the bronchus also is involved in asthma. Then sinusitis. Sinusitis occur in the upper respiratory tract. Cough also occur in the upper respiratory tract. So bronchitis and asthma. Now, take note. Why? Bronchitis does not occur in episodes, right? Bronchitis cannot be provoked. It, it stays as an infection. Now, they are telling us that a disease that allergens trigger the release of histamines. It's only asthma that can do that. Only asthma, whereby allergic reactions occur either in the body or things something can the person can inhale something and then they can inhale the allergic chemical. It gets into the body now releases histamines, hence the episode occurs.